You are sitting in a hospital corridor, holding a letter you were not expecting. A letter that uses clinical language to tell you that the rehabilitation your loved one's doctor ordered is no longer covered. The plan that was supposed to protect your family during exactly this moment has just decided your loved one has recovered enough. The doctor disagrees. The algorithm does not care. 90% of Medicare Advantage plans sold in America today contain a mechanism that is not disclosed in any enrollment brochure and not visible until the moment your family needs coverage most. The system is not designed around your loved one's recovery. It is designed around a projected savings line item written into an internal document before your loved one ever checked into a facility. By the end of this video, you will know the one action that reverses 82% of these denials and exactly how to execute it within the 72-hour window before that right expires permanently. The U.S. Senate Permanent Subcommittee on Investigations reviewed 280,000 pages of internal documents from UnitedHealthcare, Humana, and CVS/Aetna, publishing their findings on October 17, 2024, in a report titled Refusal of Recovery. The HHS Office of Inspector General separately found that 13% of all prior authorization denials by the 15 largest Medicare Advantage organizations met Medicare coverage rules exactly. 13% of denials were coverage that should have been approved and was not. That is not an error rate. That is a business model. The first mechanism is called prior authorization. The industry says it exists to prevent unnecessary care. What it actually does, when you read the internal documents Senate investigators pulled from UnitedHealthcare's servers in Minnetonka, Minnesota, is place an algorithm between your loved one's physician and the care that physician ordered. United Health Group deployed a tool built by its subsidiary Navi Health, headquartered in Brentwood, Tennessee, called NH-Predict. The tool generates a predicted length of stay for skilled nursing facility patients. That prediction becomes the ceiling. Internal documents show UnitedHealthcare pressured employees to keep patient stays within 3% of the algorithm's prediction. Not the physician's recommendation, the algorithm's prediction. Between 2019 and 2022, UnitedHealthcare's skilled nursing facility denial rate surged from 1.4% to 12.6%. A ninefold increase in 3 years. Optum, United Health Group's Care Services division, acquired Navi Health in May of 2020. Before the acquisition, the denial rate was 1.4%. After the acquisition and algorithmic deployment, 12.6%. That is the same timeline. A federal class action filed in the U.S. District Court for the District of Minnesota, estate of Gene B. Locken et al. Versus United Health Group, alleges the NH-Predict tool generates wrongful denials at such a rate that 9 out of 10 challenged decisions are reversed on appeal. A federal judge allowed breach of contract and good faith claims to proceed in February of 2025, finding credible the allegation that UnitedHealthcare used an algorithm rather than the clinical staff its own contracts promised. Gene Locken was 91 years old when he fractured his leg in May of 2022. UnitedHealthcare covered 19 days of therapy. His family paid approximately $150,000 out of pocket over the following year. Gene Locken died. Only 11.5% of denied prior authorization requests are ever appealed. The companies know this number. The entire financial architecture of the prior authorization system is built on the certainty that the vast majority of families will not push back. The second mechanism lives inside CVS/Aetna's internal documents. CVS Health, headquartered in Woonsocket, Rhode Island, built a prior authorization tool called Post-Acute Analytics and originally projected $10 to $15 million in savings over 3 years. Months after deployment, that projection was revised to $77.3 million over the same period. The Senate report also found CVS Aetna internally considered reducing prior authorization volume, then chose not to because the savings loss was, in their own language, too large. They ran the numbers, chose the denials over the coverage, and wrote that down. What this document shows, when you read it carefully, is not a company that discovered its tool was too aggressive. It is a company that measured the gap, projected it in financial models, and chose to preserve it. That is not a compliance failure. That is precision, and precision means intent. Humana, headquartered in Louisville, Kentucky, showed the same pattern. Senate investigators found Humana's post-acute care denial rate in 2022 was 16 times higher than its overall denial rate. Post-acute care is where the large costs accumulate. The algorithm knows where the money is. The financial consequence of a single SNF denial runs between $9,000 and $11,000 per month in out-of-pocket costs for families who do not appeal. For a 90-day course of denied care, that is between $27,000 and $33,000 falling onto a family that purchased coverage specifically to prevent that outcome. Before we get into why all of this exists simultaneously, if you are finding this useful, this is what this channel does. Every video covers something the senior living industry would prefer your family never found out. Subscribing means you will not be the last to know. The deeper you go into how the Medicare Advantage prior authorization structure actually works, the more one pattern becomes impossible to ignore. Medicare Advantage plans receive a fixed monthly premium from the federal government per enrollee, regardless of how much care that enrollee uses. Every denial of care is a financial gain. Every approval is a financial cost. The algorithm is not malfunctioning. It is functioning exactly as the financial incentive structure requires. The Centers for Medicare and Medicaid Services, headquartered in Baltimore, Maryland, requires Medicare Advantage plans to cover the same services original Medicare covers. The HHS Office of Inspector General found 13% of reviewed denials were for care that met those rules exactly. The coverage was owed, the denial was issued anyway. What Senate investigators found, working through 280,000 pages of internal documents in that hearing room in Washington, is a gap the companies measured, documented, and in at least one case chose to preserve, because eliminating it was too expensive. That is not a system that occasionally fails. That is a system succeeding at exactly what it was designed to do. The Senate report's most dangerous finding for the industry is the same figure Gene Lawkins' family learned after $150,000. The appeal system reverses wrongful denials at a rate the company's own data predicted. The financial model works only because almost no one applies the scrutiny. Everything before this point is what the industry hopes you never find out. What follows is what they are genuinely afraid you will do with it. The 72-hour expedited appeal is the most powerful tool available to any Medicare Advantage enrollee facing a skilled nursing facility denial. And it is the tool the entire prior authorization architecture depends on families not using. 82% of appealed Medicare Advantage denials are reversed. The appeal deadline begins the moment you receive the denial notice. First, request the denial in writing immediately. The plan must provide a written notice citing the specific clinical criteria used. Contact the plan's member services department directly. Do not accept a verbal explanation. This takes under 30 minutes, costs nothing, and is the foundation of every step that follows. Second, file the expedited appeal within 72 hours. Contact the plan's Appeals and Grievances Department. State that a physician has determined the care is medically necessary and request expedited review. The plan must respond within 72 hours. This takes 1 to 2 hours and costs nothing. It activates the right that reverses 82% of denials. Third, contact your beneficiary and family-centered care quality improvement organization. The 2025 CMS final rule expanded these rights, requiring independent QIO review of SNF service termination appeals and eliminating the forfeiture rule that previously stripped your appeal rights if you left the facility. You can locate your state's QIO through the official Medicare website or the Medicare helpline. This review is free, independent, and typically decided within one business day. It prevents your family from paying $9,000 to $11,000 per month, while a dispute the plan would likely lose is still pending. Fourth, file a complaint with your state insurance commissioner through their official state government office. This takes under 1 hour, costs nothing, and contributes to the regulatory record that triggers oversight of denial patterns at your plan. Fifth, before enrolling in any Medicare Advantage plan, use the federal Medicare plan comparison tool available through the official Medicare website to compare prior authorization denial rates. This data is public. Most families are never shown it during enrollment. Reviewing it takes under 2 hours and costs nothing. The complete protocol takes 4 to 6 hours. The average cost to a family that skips it runs between $27,000 and $33,000 for a 90-day denied stay. Before this video, you were exactly the person the Medicare Advantage prior authorization system was financially optimized to find. Not because you were uninformed, because the information was deliberately kept where families in crisis do not have time to look. You were the family holding a denial letter, facing a system that had already calculated you would not appeal. You are now the family that can file the expedited appeal within 72 hours, request the written denial with clinical criteria, and contact your state QIO the same day without losing that right by leaving the facility. The algorithm's entire financial model depends on families who do not know these steps exist. You are no longer that family. If your family has dealt with a Medicare Advantage denial during a rehabilitation or skilled nursing stay, share what happened in the comments, because understanding how widespread this actually is matters, and your experience is part of the story this channel is building. Every video on this channel is built around one principle. Your family deserves to know how this system actually works before you are inside it. Subscribe so the next investigation reaches you in time to use it.